If you ever felt confused between spider veins and a venous ulcer, the CEAP system sorts it all. It's like the TNM for varicose vein, clinical, complete, and clear. What does CEAP stand for? CEAP is equal to C for clinical, E for etiologic, A for anatomic, and P is pathophysiologic classification. It's the standard classification used worldwide to assess chronic venous disorders, including varicose veins and venous ulcers. Now let's see each one by one. C is clinical classification. From C0 to C6, this is what we see on the patient. C0 is no visible or palpable sign of venous disease. C1 is telangiectasia or reticular veins. C2 is varicose vein. C3 is edema. C4 is divided into C4A is pigmentation in eczema, whereas C4B is lipodermatosclerosis or atrophy blanche. C5 is healed venous ulcer, whereas 6 is active venous ulcer. Add S for symptomatic and A for asymptomatic. For example, C2S or C4AA. Now, etiological classification is what is the cause. Here it is categorized as EC is congenital, EP is primary, ES is secondary like post-DVT, and EN is no cause identified. Coming to the A, that is the anatomic classification. Here we see where is the problem. AS is superficial veins, AP is perforators, AD is deep veins, whereas AN is no anatomical location identified. Now coming to the pathophysiologic classification, here we see what's going wrong. PR is reflux, PO is obstruction, PRO is both, and PN is non-identifiable pathophysiology. So to summarize, a patient with varicose vein, healed ulcer, primary disease in superficial vein with reflux would be classified as C5, EP, AS, and PR. It may seem long, but it's systematic and essential for documentation, research, and clinical decision making. If TNM guides cancer, CEAP guides veins. Do not forget it during your case presentation or exams. Comment C6 if you have seen a patient with an active ulcer, and I'll share the best wound care tips for the next.